A cancer diagnosis can be confusing and, of course, terrifying. But did you know that up to 50% of cancers are related to your lifestyle behaviors, such as poor diet, lack of exercise, tobacco, alcohol? All of those factors can significantly increase the risk for developing various cancers. Here to explain all of that is Dr. Heidi Rula and Dr. Tara Iyengar from Ironwood Cancer and Research Centers. Welcome, ladies.
Thank you.
We just can't get enough of this good information that you're providing for us today. Dr. Rula, I want to start with you. Hereditary versus lifestyle. A lot of people just automatically assume that the risk is higher because of hereditary.
Yeah, I mean, we have a lot of patients who come into us and say, you know, I'm not worried about breast cancer, I'm not worried about colon cancer, nobody in my family has it. Where, you know, that's when we have the discussion that say only 5 to 10% of cancers are inherited, where the majority really are from modifiable lifestyle behaviors. And so that really is your chance to look at prevention, how to really make sure that you're not going to go on to develop a cancer.
Okay, and when you talk about lifestyle, we talk about bad, poor lifestyles, poor choices. Is that what you mean?
Absolutely.
Okay, like some of the things I just mentioned, right?
Yeah. So I mean, you know, certainly food has been really being looked at. You know, the standard American diet is, you know, being implicated in a lot of different chronic diseases, and cancer is one of them. You know, we see, you know, that those individuals who eat a low amount of fruits and vegetables have a significantly higher, you know, risk of developing cancer. If you're a smoker, right, or you drink, you know, if you you know, use a lot of alcohol in your life, these are all, you know, risk factors for developing cancer.
So Dr. Iyengar, you guys have really followed along a lot of research that's been done on the Mediterranean diet and really the benefits of that. So first of all, explain to me exactly what the Mediterranean diet is. We hear about a lot of diets.
Absolutely. And so basically what constitutes a Mediterranean diet is lots of fruits and vegetables, dark leafy green vegetables in particular, nuts, beans, lentils, and a good consumption of olive oil by itself, not necessarily cooking with it, but actually consuming it, say, as part of a salad dressing.
Ah, okay. All right. Well, that's easy to do. Why is it that just a simple change in your diet matters?
Because you're trying to maintain a healthy body weight, and so the body mass index that's often quoted in a lot of studies relates to just how much body fat you have in general. And especially when it relates to breast cancer patients, the higher the amount of body fat, your increased levels of estrogen are also correlated.
Really?
Yes.
Yes. That just fascinates me. I'd never heard that before. So whether or not you have been diagnosed with breast cancer, just lowering your BMI obviously is best, even if you have been diagnosed, for survival.
Absolutely. There's an increased improvement in survival almost by 50% in terms of just mortality in general for patients who exercise several times a day or several times a week compared to somebody who's just stationary. And that change doesn't just have to happen pre-diagnosis. That change can happen post-diagnosis and can still have a meaningful impact.
Okay, eat right and exercise. We hear it over and over again. So many benefits to it. Real quickly, Dr. Rula, the supplements that you really prefer. Give me a quick synopsis.
Well, I mean, a lot of individuals are using supplements. For cancer, you know, we see kind of 2 stars, and I would say, you know, vitamin D, your sunshine vitamin, lots of evidence to show that higher levels of vitamin D lower your risks of a number of cancers, including, you know, skin cancer, colorectal cancer, and you know, as well as breast cancer.
Okay, so you heard it here, right? It's never going to end. Eat right and exercise for better health. Ladies, thank you very much. Really appreciate you being here. Ironwood Cancer and Research Centers, they have 10 Valley locations to choose from. You can book an appointment and learn more at 480-821-2838, or you can visit the website ironwoodcrc.com.